So before we start, I just wanted to say thank you guys for doing this, because when I went through this with my grandmother after my mom had passed away, she had everything in order. She had done all the legal stuff, all the medical stuff, and it was still awful for me personally going through all of it. And she had it all in order. So for you guys to be able to explain to the community how to navigate this, what to understand, what questions to ask, I think is a real service. And so from personal experience, I appreciate that you're doing that. So the general theme today is navigating the certainty of aging. We all know we're going to age. We all know this is going to happen. The question is, how do we work our way through it? So we're going to start with the first theme, which is preparing. Jason, what do most families overlook from planning when they reach retirement age, and how do they navigate this process?
One of the biggest problems that I see for people as they're approaching retirement is they want to think about all the fun things they're going to do in retirement. They're going to see grandchildren, the travel, the getting that honey-do list finally taken care of. And what they're not looking at is what happens when things shift and change in retirement, because inevitably that is how it typically happens. And so while we can plan ahead for good times, we also want to have a backup strategy for what happens when things go sideways. And for some people that might be looking at, do we need long-term care insurance, or do we need to just better fund our IRA? And so at that early stage, it's not so much getting a lot of documents down, but learning what do they need to be looking for and making small tweaks to their current system.
Let's just kind of start with some of the basics. Stacy, what is home care?
Home care is, what we do is we provide all the non-medical care in the home, so or wherever an older person may call home. So anything from your light housekeeping, your laundry, your errands, your shopping, even personal care services. We do provide Alzheimer's and dementia care services. All of our caregivers and home health aides do go through Alzheimer's and dementia training, and it is endorsed by the Alzheimer's Association. So that's something that we're very proud of. I think, with the caregivers, it really is important to make sure that they are fully trained. And of course, something else that's really important is to make sure that people know that when you're looking around for home care, is to make sure that they are, they have the fingerprinting, which is very important. Make sure that they have all their background checks, motor vehicle checks, making sure that they do have education in place. I think that a lot of families, they're not quite sure what questions to ask, and those are important questions to ask when you're shopping around for home care. Right now, Home Instead, we've been doing virtual care as well. And what's really neat about virtual care right now is that we're trying to reduce traffic in the home. And of course, it's a great communication tool between us, the caregivers, and the clients. And the clients also have communication with their family members as well. So our home care tablet is very easy to use. This is it right here. So we're very proud of this. And, I think it's going to be the future of home care.
And Shay, just again, kind of getting to know basically what you do. What is home health?
Home health care is designed to help a patient rest, recover, and receive treatment in the comfort of their own home. Home health care is a service provided by healthcare professionals that enter the home to help you recover. There's a range of services that can cover home health. For instance, skilled nursing. Skilled nursing comes into the home and includes assistance with medications, wound care, help with education, caregiver training, and also things like IV treatment at home. Another service is rehabilitation, like physical, occupational, or speech therapy. These include a home safety assessment and evaluation, exercise plan, and all to help you manage your activities of daily living. We also provide social workers, medical social services, and that is to help you access community resources and make sure that you are living your safest life at your home. The whole goal of home health care is to help patients be as independent as possible and to heal safely at home. Our care team is here to empower you to learn how to best care for yourself and for your family to help care for you the best that they can as well.
SHAUNA, talk a little bit about the difference between skilled nursing and long-term care. Sometimes terminology, people have heard these words, but they don't really know exactly what they are.
Skilled nursing is normally after a hospital stay in a skilled nursing facility. The patient is ready to discharge from the hospital, but not quite ready to discharge home. So discharging home before a skilled stay can be unsafe. So the goal is to make sure the patient is safe before discharging home. Therefore, nursing carries out orders written by a physician, and services include physical therapy, occupational therapy, speech therapy, and nursing care. On the other hand, long-term care, the patients reside in the facility. The facility is their home. And their care includes bathing, dressing, toileting, grooming, eating, along with nursing care and medical care as well.
So they might go into the hospital, then transition to skilled nursing, and possibly then transition to home care, yes, home health, or to long-term care where they might, but they don't need that same higher level of ongoing nursing attention. Is that kind of the...
Correct.
John, what's the most important thing that I could do to help my aging parents?
So the most important thing is to have a conversation. All the things that are being discussed needs to be within the family. So you need to have a conversation with your parents, or if you are the parents and you're thinking about what's going to happen in the future, then you need to be having that conversation with your kids. Sometimes it's very difficult for the senior population to tell their kids, hey, this is my finances, because they're so concerned that maybe I didn't do a real good job. And I do hear that a lot. I hear, you know, my parents make good money, but they don't have any money. So you need to have that conversation and say, let's be real here. Let's be honest with each other. How's your health? What are you doing with your finances? If something happens, what can you do? What are your plans? And then they need to have that conversation with their kids and say, hey, it's okay if it comes down that I need to go to an assisted living or I need to go to a nursing home. It's okay. The hardest part is when that child says, I will never put you in a home, and you just can't guarantee that circumstances can change. So the important thing for me, have a conversation between the kids, the parents, and anybody else that might have some influence in that area.
And Elizabeth, similarly, let's just talk a little bit about, you know, what is hospice and, you know, how do you qualify for it? And I mean, how do you become even eligible for it?
Okay, so hospice care is provided for people who have been given a diagnosis, a terminal diagnosis, and also given a prognosis of 6 months or less. And so a patient is eligible for hospice care when they've reached the point of experiencing certain specific disease-related symptoms, and then also at a point where they choose to focus on comfort care rather than curative treatment. And I guess as far as the key indicators that would give a person an idea that it might be time to consider hospice would be the frequent hospitalizations. They might have unintended weight loss, frequent falls, the need for constant medication changes. Those are some of the things that are going on when the disease is progressing to a state that might indicate that it's at the end stage. Also, with hospice care, I would say that it's the overall decline of the condition that's the overall indicator. So when a doctor is ready to write that order, certifying that the patient is meeting the criteria, then that's when hospice can come in and assess and admit the patient. The overall goal of hospice would be to make sure that we are focused on keeping symptoms under control and managing pain. If we are effective at doing that, then we're able to keep the patient comfortable. Therefore, the patient is no longer struggling or suffering. And that's the ultimate goal of hospice care, and to give the support to the family that's needed.
So our second theme is paying. Obviously, that's a pretty important part of this concept. Stacy, who pays for home care, and do you have to sign a contract?
No, you don't have to sign a contract. We actually call it a service agreement. So you're just agreeing that to use our services in the home. And really the way that we set it up is to protect the caregiver and the client themselves. So the service agreement also talks about payment. So different ways to pay for home care is, the first one is private pay. Insurance does not pay for us unless you have long-term care insurance. And I know that was something that Jason talked about earlier. I really try to encourage the families to look into that. whether it's, for themselves or if it's for their parents, if they do qualify for long-term care. There's some great policies out there that have hybrid, so they can get life insurance and long-term insurance together. And so then they never lose the money. Another way that can pay for home care is VA. So VA does pay for our services. You can go to Aid in Attendance and track to see if you are able to qualify for Aid in Attendance.
Shay, who refers patients to home health, and how does that get paid for?
Your primary care doctor or your specialist can refer you to home health care services, or if you are in the hospital or at a rehabilitation facility, your case manager or social worker there can refer you for service when you discharge home. Home health care is paid for by Medicare or through private insurance and usually has no out-of-pocket cost for the patient.
SHAUNA, once a patient is admitted into a long-term care bed, does Medicare pay indefinitely? How does that work?
Once a patient is no longer skilled and resides at a skilled nursing facility for long-term care, Medicare does not pay for room and board. The patient will either have to pay privately or apply for Medicaid to cover costs. They may have to also pay a portion of their income to pay the difference that Medicaid doesn't pay. So we always suggest that before placing your loved one into a long-term care facility, you contact an attorney to see if you need assistance with financial planning.
So at what point exactly does Medicare stop covering you?
Once a patient's off of the short-term care, which is skilled nursing.
Okay, all right. Because they're like a medical payer rather
Correct.
than a residence.
Another way to think of it is that the skilled patient is covered by their insurance. Once you're long-term care, it's no longer insurance. It has to be Medicaid privately or private pay.
Would it be helpful to point out that it's 100 days of cover?
For skilled nursing.
The skilled nursing is going to max out at 100 days typically.
Elizabeth, what's the benefit of choosing hospice care?
Well, I guess the greatest benefit is that Medicare pays 100% of the hospice benefit. They also get to regulate. So all of these eligibility criteria and everything is set forth by the Medicare. It's established by that hospice benefit within the Medicare plan. So even if you have an Advantage plan or some other type of plan, if you're eligible for Medicare, it's going to roll back to that original traditional Medicare program to pay 100% of the benefit. So that's probably the greatest benefit. But also I would say that hospice really helps the patient, the family minimize the frequent hospital readmissions and really keeps that rate down for the hospitals and everybody involved. But I think another really good benefit that I've experienced with hospice and with the families that we work with is that so often there's dramatic and often very frequent changes and symptoms that can create a lot of fear and panic with the family. So with hospice on board, we're able to come in and sort of guide and educate and help steer the family and help the patient with understanding this is the normal process that's going on and there's no need to panic and fear. So it kind of helps calm and keep a lot of peace going on within the environment. I would say probably hospice being in place sooner rather than later also gives the patient and the family time to have those conversations and to maybe finish up the unsaid, unspoken business that hasn't taken place. So time to prepare.
So like it gives them a sense of where they are in the process better to know we really need to address these things or we want to make sure this gets said.
Over the situation. Yeah, absolutely.
John, why should somebody use a locator service instead of, say, just going and looking for themselves or, picking for themselves?
Cost is definitely a legitimate concern for assisted living. And just a round number, you can get into assisted living for about $1,500, but it can go all the way up to $7,000 depending on a lot of circumstances. So what you do with a locating service such as assisted living locators, we're going to save you time, energy, stress, and money, because there are over 40 facilities within the Pensacola area, and once you start calling them, it's their job. They're going to start calling you back, And then you're going to say to someone, well, I thought you said it was only $3,500. No, that wasn't us. And then you start getting confused. So what we do as a locating service is we have it funneled through us. And by the time we get done, we know the communities so that you're not trying to get into a place, number one, you can't afford. Number two, that can't meet your medical needs. And so we're going to eliminate all that process for you. We're going to do the legwork for you. We know the communities. We know what they can and they can't do. We know what they cost. And so we're going to take that time for you and let you concentrate on taking care of your parents until we are able to put you in a good location at a good community. So therefore, using us saves that money. And we can also help you save money because you might be familiar with 3 or 4 communities and you say, well, I've got a friend over here or Aunt Martha's over here and we're just going to go there. But we can say, but there's another place that's just as nice, meets all your needs, but it costs you a little bit less. So cost is definitely legitimate, but as assisted living locators, we can help save you that time, energy, and money.
And plus, this is this is a challenging time of life for people. They don't probably know as much as they should, and you guys help them sort of navigate that process effectively to their benefit and to their loved ones' benefit.
Absolutely do. And we're constantly advocating for that family to make sure that they're going to the right place and guiding them through that system. Correct.
Jason, can a family receive assistance with the cost of long-term care regardless of their financial status?
There's going to be natural caps to, regardless of wealth. Bill Gates isn't going to transfer his wealth to be able to get Medicaid. I just don't see that happening. But for the average person, yes, there is things that can be done, and that comes down to that planning process. So that if we know that this is a veteran who served during Korea, for example, so aid and attendance may be able to help pay for some of the things like Stacy was saying. Well, we know we need to be looking at their assets in a different way. If we're looking at skilled nursing, and so Medicaid may come into play, we're going to look at their assets in a different way. It's not so much you have to be completely penniless to be able to get assistance, but you do have to have it in the right way. For example, a family might have a house, a car, and some money in the bank, say $150,000 in savings, and they need long-term care. Well, they would be disqualified because that money's just sitting in savings and investments. They can have up to $130,000. So they're just slightly over, and they wouldn't realize that. They start private paying, and that causes a problem. Where you have another family that has a house and a couple of cars and an IRA with $500,000 in it. Well, they can go straight into skilled nursing and get Medicaid because of the way assets are structured. And that's where meeting with an elder law attorney helps, because we're familiar with all these different programs, and we help align their assets so that they get qualified faster.
Our third theme is provision, and we're going to start with SHAUNA. How does the process work for getting your loved one into a long-term care bed?
The process is quite simple if the loved one is already in a skilled nursing facility receiving skilled care. The patient can just transition into a long-term care bed. If not already in a facility, the process is more difficult, but not impossible. I would tell viewers to narrow their search to 3 facilities. Contact the admissions department at those facilities. Ask about a waiting list and bed availability, as well as contact the business office to provide financial documents. Then reach out to your primary care physician for documentation. The facility has to see documentation to support why your loved one needs to be in the facility. So they need to see that before admission. After that process is done, I would follow up with the facility probably between 2 and 3 weeks, because they receive numerous calls every day about long-term care. So it's kind of like the squeaky wheel gets at the end of the ball game, they get the bed.
Shay, In the question of provision, what should I expect from home health care?
Sure. Once your doctor orders home health care, your home health clinician will reach out to you within 48 hours to schedule an initial assessment. During that initial assessment that will happen in your home, we'll review things like your goals for home health care and come up with a treatment plan for you. So that treatment plan, taking into consideration what your goals are and what your doctor has ordered, is going to decide how frequently that home health comes and visits you. It is important to remember that home health care is intended as a short-term intermittent service provided in your home and is not a long-term option. Typically, visits happen about 2 to 3 times a week and last about an hour for each visit. And of course, as you improve, that tapers off and the visits become less frequent. And we will always communicate with your doctor how you're progressing and if there's any changes in your condition and you need any more home health orders.
Stacy, what are the different levels of care that home care services provide?
Well, there's 3 levels of care. You have just companionship, which is, more if someone just needs respite care or if they just need someone to sit with them and have conversation. The next level of care is home care. So you would have more of like your light housekeeping, your laundry, your errands, your shopping, even cooking meals, going to the doctor. I mean, those are all things that people need to stay home. We have personal care services too. So that's your bathing, grooming, incontinence issues. And then we also do specialty care. So it'd be Alzheimer's, dementia care, even hospice support for people that are bedbound.
And John, how do you get started? How does this all begin?
So, as we spoke before, you need to have that conversation, but what you need is an honest assessment. So many people, especially if they're out of town, they make the phone call to mom and dad, "Are you eating?" Yeah, we're 3 meals a day, but that might include toast and coffee, and then they'll eat a sandwich, and then at night they're eating Twinkies and popcorn. And they think they're doing just fine. And then the medications, yeah, we're taking our meds, but as we grow older and that pill drops on the floor, we got to take a look at it and decide, am I bending over and getting that pill, or am I just going to take 2 tomorrow or take another one? So an honest assessment is the key to knowing, do they need home health? Do they need home companion care? Where are they in life, and whether they need to go to a home, an assisted living or a skilled nursing facility? So an honest assessment and then a guidance to be geared towards that senior. A lot of families like to come in and make that decision, but you need to include the senior. Let them know what's happening. Let them know what your concerns are, and then you need support that you can lean on. So many times you almost have to do an intervention for the family because you got brothers that say, they're fine, just leave them at home. And then you got daughters that said, oh man, we need to really just do this, this, and this. But you just need to have an honest assessment. Where are they at? What do they need? And let's get the resources for them.
And Elizabeth, what are the different services provided by hospice care?
So hospice care is provided by, first of all, an interdisciplinary team of professionals, which is made up of the medical director who creates and oversees the plan of care. Then you also have a case manager who is out there implementing that plan of care and creating this highly specialized skill care for the individual patient to their needs, cater to their needs. Then you also have the hospice aide, who is a CNA, certified nursing assistant, to go in and help with the bathing and the grooming needs of the patient. Very important. Then also there's a social worker. They're very involved with the family, especially with the emotional support and also helping to connect to resources in the community. A chaplain who's helping with the spiritual support and bereavement even after the death of the patient for 13 months, providing that support. And then there's also trained volunteers who can also participate in helping in different ways. But then also included in the services is the supplies that are brought into the home wherever the patient calls home to receive this care. Medical equipment is also included, as well as the medications.
So it's comprehensive.
Very.
Jason, When somebody needs care but has financial factors that are in the way, how do you speed up that process? Because time is obviously essential.
Biggest hindrance to be able to get it accomplished quickly is the knowledge of what assets people have. It's fascinating how many people will get into retirement and they not really know exactly what they have. There's life insurance policy, but I don't think it really has much value. Well, if it turns out it has cash value of, say, $5,000, it can completely derail being able to get Medicaid at the right time. So the best procedure doesn't involve a professional at all. It has to do with just managing your money and keeping track of where everything is and keep it in one place. Then getting it to someone such as myself, an elder law attorney, who's used to be able to move the money if it needs to be, or tell you it's okay. Because again, a lot of people think they don't qualify that do. And just knowing what you have can help us answer that.
When I was dealing with my grandmother, 80% of her assets were easy to understand, and the others were, I remember I found a piece of paper that I didn't know needed to be handled, and it turned out to be the payment for the long-term care insurance. Oh. You know, or a bank account that hadn't, you know, an annuity that hadn't been dealt with in 10 years. Well, that turned out to be $10,000. How common is that for even the senior not to know, let alone the family to know which pieces are how large and where they are?
It's incredibly common because what we find is people, you have a husband and wife and say maybe the husband managed all the finances and he's passed away and now the wife is behind. She didn't know that for the early parts of their marriage they were buying life insurance. We had one family, the daughter brought in a big banker's box and she goes, don't worry, only about this much applies to you. The rest of it, I was just going to throw it in your shredder if I could. And I said, well, what is it? And we started pulling it out, and it was $1,000 life insurance policies that had been paid up. And they were completely paid up in the early 70s. They were all, you know, valid. By the time I went through the whole box, we found $48,000 she didn't know existed. And so it completely changed things. And so having that conversation that John was talking about in this prior section is very important. You want to be able to sit down with the family and make sure somebody knows what is there, or at least keep a good record of it.
I was going to say and mention at Home Instead, we like to call that the 40-70 rule. So if you're at least 40 and your parents are at least 70, it's time to start having those conversations. And, you know, sometimes there are some communication gaps between the adult children and the parents, especially when there's some power struggles on who's going to make decisions. So in that case, we call it the 70-40 rule. So the parents can actually go to the children and talk to them. It's, you know, very, very important for the families to have open communication with each other and make sure they all know what their wishes are.
Which requires the parents to know their status, requires them to be willing to talk about this stuff with the kids. The kids have to be open to learning and willing to understand what's going on. I mean, it's a lot of communication like John keeps talking about. All right, so now we're going to switch to the theme of planning, which is obviously really important. Jason, most seniors are eventually going to need long-term care, and if you do believe that you're eventually going to need it, how long in advance do you need to start planning for that eventuality?
It's really going to depend on where we're at with that family. If they went back to that early suggestion that I had when they were retiring and they were meeting with someone and getting those fundamental documents like the power of attorney that deals with financial matters and the designation of healthcare surrogate that deals with medical matters, then we're good ways into it. But really the earliest we want it is if there's a diagnosis of some sort of illness. They need to be coming in to meet with us because then at that point we can look at where are we, what do we have to work with, and what's to come, and help them plan that out.
Is there an age, maybe, that people should really start planning?
I got to be honest, the starting the planning is as soon as they have someone they trust to handle their affairs. Okay. That's my age. So that could be somebody who's in their 20s or 30s, because remember, the two biggest cases in this country that deal with living wills, for example, a terminal diagnosis, were females in their 20s, right? But as they get older, when they're in retirement, they need to have those documents in place if they have someone. Then we want to be able to help transition over to long-term care planning and figuring out what do we need to move forward with from a planning standpoint with assets and family members and team.
And you said medical power of attorney or medical surrogate and legal power of attorney. Are those typically the same person, or are they sometimes split among two different people?
I would prefer if it was the same person, but with a lot of families, it's not. Family dynamics come into play, and we have different things at odds where nobody wants to leave somebody out or hurt somebody's feelings, so maybe they put the son as the healthcare surrogate and the daughter as the power of attorney over finances. It works better when it's the same person because then we have that one point of contact. We know who the decision maker is, so we can provide services faster. But that's not what always keeps family harmony. And I will say family harmony can go a long ways in a good plan.
Would you all kind of agree that sometimes in the process people can forget that they're a family? And that's like one of the key things that everybody has to keep in mind to be focusing on that all the time?
Family dynamics is really crazy. I had a 91-year-old gentleman that I was moving into assisted living. His 70-year-old son said, could you go in there and ask Dad if he'll sign the power of attorney? Because I'm still a little intimidated by him. I'm thinking, the man's 90.
You're 70, you should be able to handle
That's just good parenting is what that is. All right. Elizabeth, for hospice care, do people need to know it's time for hospice care, or should they call you when they're not sure if it's time yet?
I would recommend they call when they're not sure, because we can help them, guide them through that process of making that decision. It's very difficult to know. The person on the street doesn't necessarily think of hospice. They don't want to talk about hospice. They don't want to go there. So they're going to wait till there's a crisis situation more often than not, because then they're forced into thinking of hospice. That's not the time to be considering hospice. It's way before that. And I often say, and I say it 2 or 3 times a day to people that I'm having conversations with, a premature hospice conversation is far better to have than a last-minute crisis situation conversation where you've got to make those hasty decisions. So give me the opportunity to have that premature conversation, and I'll do it all day long. The information I share could be overwhelming, as anybody in the hospice environment is sharing this information. It's overwhelming, and it's very difficult to receive when you're in a state of confusion and stress, and you're weary and you're worn down from spending nights in the hospital with your loved one. You're not receiving the information very well. So it breaks down the communication channel.
How much of an issue is that? I imagine for a lot of people, they're reluctant. If they understand what hospice is, they're reluctant to take that step because they feel like that's, so close to the end, and they don't want to realize they're at that phase.
But the end is going to happen.
Right.
The end is going to happen with or without hospice. I learned that the hard way on my own personal experience with my father's death, when I wouldn't even have a conversation with hospice. So years later, I realized that, wow, who did I think I was that I was going to stop that from happening? So hospice is not something to be feared. It's actually to be embraced, because it is the most beautiful service that can come in and help support the family, give the necessary care for the patient to keep symptoms under control and well managed, so that there is no suffering, that there is no pain, and that there is peace and dignity for that person's life. And so it's all about protecting the person's dignity at the end of their life and honoring their wishes.
SHAUNA, when people are thinking about choosing a skilled nursing community, what are some of the key questions that they want to ask?
First, if I were choosing a facility, I would look at 3 facilities, because you don't want to put all your eggs in one basket and that falls through. I would look online, look at if there's virtual tours, look at the comments that people are leaving online, whether it's social media or not. What's the location is one of the questions, because it's important, because you need access to your loved one. What's the bed availability? Also, what's the star rating? What does Medicare CMS website say about that facility? Look at the quality measures. And probably the last question is, does the facility have a restorative program which consists of CNA, certified nurses assistants, that are able to do therapy with the long-term care patients. So is that program in place in that facility?
Shay, how do I know if a family needs home health care services?
You should ask your doctor about home health care after a few signals have happened. The first would be if you've been to the hospital recently. Anytime you've been to the hospital, that signifies that there's been a change in your condition, and it might be an important time to think about home health. Another would be if you've got a new diagnosis or a change in your medical condition or a change in your medication. All of those may be signals that it's time to consult with home health care. Another would be if you're having weakness or have had a recent fall. It may be time to talk about physical or occupational therapy to come into your home and assist with that. It is important to remember that home health care is short-term and intermittent, and that our whole goal is to keep you at home and as safe as possible.
How often do you run into a problem of somebody's not willing to recognize that there's been a change because, oh, it's just a fall, or it's just a change of medication, or I'm just sleeping differently, or whatever it is for the senior, but also for the family members, because big changes can happen in a short period of time, and family members might not recognize it either, right?
Right, absolutely. It is important, like the group here has all been saying, that involve family as much as you can. If a senior is living at home and they've fallen, they may not think it's a big deal, but their son or daughter or their neighbor may have known that they've fallen. It's important to keep that communication as open as possible so that their doctor can eventually learn about the fall and contact home health to start care.
Stacy, what's the sort of the minimum and maximum amount of time that home care can spend in the home?
Well, the minimum can be here at Home Instead is 2 days, and it's just a 4-hour shift. So something that, someone might just need some light housekeeping and maybe some doctor's appointments, just very minimal amount of care. But we can provide up to 24-hour care. So it depends on what their needs are. If they're coming out of a rehab situation, sometimes they'll need a lot of care in the beginning. And then just like what Shay was saying, they can taper off as they get better. Sometimes if they're in a hospice situation, they might just need a minimal in the beginning. And as things start to progress, then we can increase services. So it really just depends on the needs of the person. And it also depends on financial need as well. So if somebody is a little bit wary about how much they can afford, we try to work within that budget as well. So, there's a lot of different variables. And, like I said, we just really try to work with the family and figure out what's going to be best for them and their loved one.
Are there signals that you look for or that a senior could look for to know that, home care is something I should start considering, that maybe this is the right next move for me?
Yeah, like I said, a rehab situation is a perfect scenario where they're coming out of the hospital or they're coming out of rehab and they need to come home and they want to stay home as long as possible. And home can be anywhere. It can be in a traditional home, it can be in an ALF, and it can actually be in long-term care. That can be their home. So if we want to try to get them back to where they feel comfortable so they can age in place as long as possible, that is the goal that we have in place. So, really going back to, figuring out a plan for them. What we do is whenever we start care, we start with a consult, out to the home, we do an assessment. And from there, we can start services usually within about 24 hours. And that is really catered to the needs that they need in the home. So, for example, most people, they need services. This is just an average. It's about 25 hours a week. So if you can figure, break that up into, just a few days, every other day, someone might need care. We come in for, 6 hours a day, maybe longer, and do those things that might be the most difficult part of their day, where it might be in the morning, their morning routine where they have to take their meds, eat their breakfast, get dressed. Those are times that, where they can have another fall, and we don't want to end them back up in the hospital. So to encourage those routines to get back to normal, we could do those and make sure that they're in the home. And of course, we can do a nighttime routine as well. So that's something to think about as well.
Plus, it's cool. Somebody helps you open the pickle jar, somebody helps you do the sweeping, whatever needs to be done, they help you with it, right?
It is someone, yes, it is having your own personal caregiver. And I tell people all the time, it's like matchmaker. we get the right person in there. It's like dating. Everybody is happy, including my employee. So, because my goal is to have that balance, make sure I have employees that are happy and make sure that the client and the family is happy. And, really, if we can accommodate all those, then we're good to go.
John, when you're figuring out which assisted living facility is right for a family, is that also a kind of a matchmaking process? How do you figure that out?
The most important thing is to listen. So a lot of seniors, especially if I go in and talk with them and meet with them, they want to talk. They want to talk to a human. They want to talk to an adult, and they want you to listen. So I try to get them started. And then you just kind of sit back, and as you're listening, you can filter out. Well, I've got this dog, and I'm not going anywhere without this dog. Well, all of a sudden, instead of 40 places, there's only 20. And then when they say, well, my budget is this, well, now you're down to 5 places because he can only afford those particular 5. So as you're listening and filtering to what they're saying, you're trying to build that match to 3 places normally, maybe 4 that they can go to. And then you start doing the legwork for them. And you start saying, okay, so I've checked into this and we can do that and we can make this work for you. And the location is good. So everything that we talk to them about with assisted living locators is just to compare our notes with what they want and match up 3 places. Because we're not going to make that decision for them, but we're going to give them the best decisions to try to make. And then they can compare. And then we'll just guide them through the process so that they can pick the right one that works for them.
So now transitioning to the theme of personal attention, John, it's got to be one of the hardest decisions people make. How do you convince a loved one that it really is time to move into an assisted living facility?
I tell you, it really is. And we've talked about family dynamics. We've talked about having the conversation, and that is the toughest one to have, because if you've got a senior that just says, no, I'm staying at home, and you've exhausted the home care, you've exhausted home health, and you've talked to them about different things, and it's just time. One of the easiest things to do is, if they're transitioning out of skilled nursing, is say, okay, you've done really well in skilled nursing. Now it's time for the next step. And if you do really well here, you can go home. The other thing is, you just don't want to get into the argument stage, because you've got to work again with the senior. And sometimes it just takes a little time where you have to convince them it's their decision and move forward with that. I just moved a lady into a place the other day. It's been a year and 2 months. She just wasn't ready. We just kept revisiting her. And then it got to the point where she really needed to go. So what we do at Assisted Living Locators, I believe, is personal attention. We're a local service. We're personal. And we want to help that senior get to where they need to be. And applying personal attention and listening to what they want to do and helping them get to that point. And that's the only way, is empathy, sympathy, and listening to them and letting them be part of the process.
I imagine for a lot of seniors, it's they don't exactly know each stage that comes next, and that produces anxiety and just generally fear about what's happening is a difficult thing for them to process.
What they fear a lot is the fact that as they were young, their grandmother was in a place where they were put on the wall and they just sit there and nothing was happening. Nursing homes have changed tremendously. Assisted living is that bridge where you can go and live as independently as you possibly can. And you just got to get that message across to them. We're not putting you away. We're just changing your geographical location for you to live and enjoy life best as you can.
Shay, what kind of conditions does home health care treat for or help with?
Sure. Home health care can benefit acute or chronic conditions or recovery from an illness or surgery. Some of the things that we treat at People's Home Health are Alzheimer's disease, COPD, heart disease, chronic kidney failure, diabetes. And in addition to providing these treatments for these conditions, we act as a liaison between the patient, their family, and their provider to make sure that we all have the same healthcare goals for them to help them get back on their feet as quick as we can.
And Stacy, can the same caregiver be assigned to every shift, or does there have to be rotation? You know, you were talking about matching people, so how does that work?
Well, like I said, it goes back to how many hours that the client is getting. So if they're just getting the minimum of the 2 days a week, the 4-hour shift, or even if it's just a 5-day-a-week shift, that's a perfect job for a home health aide or a CNA. And we do try to provide where we get that perfect match. 9 times out of 10, I think we get it right. If we don't, we can always make a change. And I tell families that all the time. This is not someone that you have to have permanently in your home. And it same goes with the caregivers as well. If they're not comfortable in a client's home, then we'll change them somewhere else. So there is that balance. Now, if somebody is getting 24-hour care, which people, they do, they get 24-hour care. And we've had many clients over the years that have used us for years on end for 24-hour care. And yes, they do. They have a rotation of caregivers, and they've got their favorites, and it just works. They become family, and we really try to make sure that, everybody is, like I said, happy. And so we can just keep them aging in place as long as possible, because that is the ultimate goal.
SHAUNA, when it comes to Medicare and managed care, or Medicare replacement policy as well at the skilled nursing facility, talk about some of those differences and just kind of understanding that terrain.
Because there's so much confusion, I go to the hospitals and I'm talking to families. They think that they don't have a Medicare replacement. They think it's just a second insurance to Medicare, and it's not. It replaces the Medicare. So what happens is maybe they get something in the mail, maybe they get a phone call, and maybe the phone call says, this is an added service, but it replaces their Medicare. So you have traditional Medicare, and then you have Aetna, Blue Shield, Humana. Those are some of the replacement policies. What's also important to know is when you're living at home, you may be living a healthy life, you're not having any hospitalizations. The managed care plans are more cost effective. So in the community, it may be a good thing to have that because you save money. But once a patient starts having multiple admissions to the hospital, as well as to a skilled nursing facility, home health care, it becomes difficult because the managed cares require an authorization for every single thing: the hospital admission, the skilled nursing admission, the home health care admission. They require authorizations. So at that point, I urge families to check into traditional Medicare once they get to a stage where they have multiple admissions, because it just saves with time. Time gets wasted by waiting on authorizations, and it does better for the patient.
So it's really
long run.
It's really a better fit at that point. It's more familiar with those processes and handles them more efficiently.
Correct.
Elizabeth, how long is someone typically going to be on hospice care? How long can they be on hospice care?
Well, for a pretty indefinite period of time, as long as the patient is meeting medical criteria and as long as they want to remain on hospice. They can discontinue hospice at any time for any reason at all or no reason. Also, if the patient starts improving and they're no longer meeting the criteria for their terminal condition, then it would be that the hospice would discharge the patient.
Does that happen very often, that people improve out of hospice care?
You see certain conditions and certain diagnoses where that happens most often, but we do see it. I'd say maybe 2 or 3 times a month we might be discharging a patient for no longer declining. We'll try to switch them over and transition them back maybe to home health to get some care in the home and the support they need until the time comes that then they start declining again, and then hospice comes back in and readmits. So that does happen.
I was just going to say, it seems like for a lot of people, because they perceive hospice a certain way, they would feel like that's a commitment. Whereas, as you're saying, sometimes people can actually sort of recover back and no longer need to be in hospice care.
Yeah, I would say that there's probably 2 very powerful forces at play when it comes to the hospice decision. One is denial. The other is acceptance and embracing the whole idea of aging in the first place, and then getting to the final stage of aging where hospice comes in. So I caution people every day against the denial force, because you don't want to wait till there's a crisis to have to make these decisions, any of these decisions, not just hospice, but advanced directives, going to assisted living facilities, having home health care or the care sitters coming into your home, or ended up in a hospital because you weren't proactive, and then you end up in a skilled nursing home and you get caught up in the system that where you lose control and the system is kind of dictating how things play out for you. So being proactive, accepting what's going on in your life and in your loved ones' lives, and trying to make the necessary preparations and planning for on the onset really minimizes hasty decisions, uneducated decisions, and situations where now you're forced to have to do things you don't want to do.
People don't make great decisions when they're under stress. And when they're trying to learn what to do and make a decision and stress, that's...
Especially when it can be avoided.
And listening to Aunt Martha, I keep bringing up Aunt Martha and Uncle Jake, instead of calling an advisor or calling an expert. And even in our situation as a panel, if you call me and I say, you know, all you really need is some home care, or yes, let's call hospice in because it's down. Or if you don't have the paperwork, I'm going to say, call Jason and get this paperwork straightened out. Or let's get home health in there. Call your doctor, get home health in there. Talk to an expert, talk to a professional, talk to someone that can lead you to the resources and care of what happens with you to get you to the right person. We're not here to force you into what our industry is. We're here to educate you. And if you call us, we can get you in the right direction.
I think it's kind of ironic that people plan for a wedding, they plan for a funeral, even whenever they have a baby, they plan to where they're going to have their baby, but they don't plan for their long-term care of themselves. And that's a huge amount of time in their life. It really is important to put that first so that you know exactly what your wishes are with your family.
Which actually brings us to our last question I have for Jason is, when people are thinking about some of the documents that they need to establish, a living trust, a living will, can you maybe just talk a little bit about, I mean, it's a lot of terms, you know, this whole area of life involves a lot of terminology that until you know it, you don't know it.
Well, and the frustrating part is with today's culture, and we're supposed to all be Google experts, street lawyers, whatever the term is, and a lot of people feel guilt if they don't know what they are. And what I would encourage people is knowing exactly which document isn't what their focus needs to be on. It's what do they want as the outcome. Living wills is a prime example of that. That's one of those advanced directives, and it's talking about what you want to have happen should you be incapacitated and hit an end-stage condition. We have seen people confuse that document with all sorts of things, from a do not resuscitate, which is an entirely different document, or as a month ago, we had somebody confused it with a will, and they were filling out something called 5 wishes, which a lot of hospices give out, and they had wrote on there, I want my house to go to, and the daughter believed she was going to get the house contrary to her other 7 siblings. Okay, so now we're about to have a major fight, right? All because they were stuck on, they thought they had a free document that would help, and that's just not the way to plan. And so we need to get past what are the documents called and figure out what is the goal we're trying to do and let us do it. As far as living trust, that gets to after you passed away, generally, as to sort of a mini you. You know, I have my estate, but if I want something to live past me, I create a living trust because it can live past me and help divest my estate the way I want it to. I think it's a grossly oversold document, by the way. Most people don't need a trust. I think that's a big fear factor with seeing attorneys is they think they're going to be oversold documents. And should they ever feel they're being doing that, they should go get a second opinion. Any attorney that really is looking out for them would not mind a second opinion. And so you want to know what it is you want as an outcome, and then let the attorney to help you draw up that plan.
Well, guys, you know, it's a lot of information. You know, everybody's at a different phase that's watching this, and you know, I'm sure everybody learned something, but I would say the next phase is, you know, get a hold of one of you guys and find out what they need to know next, because everybody's different. Every case is different, every family is different, and I just appreciate you guys taking some time to educate people. Like I said, I know for us, it was done very well and it was still hard, and so I just hope this makes it a little bit easier for everybody else.